Did the president consult you as we pursue this fraud?
I don't know anything about that case.
Fair enough.
Congressman, I can say this. This has not been, although it's a bipartisan issue and there's bipartisan passion for this issue, the application, the implementation of anti-fraud has not been bipartisan.
So let me go to the next one, Mr. Secretary. How about Joseph Schwartz? He pled guilty last year to bilking taxpayers out of more than $38 million, paid himself millions of dollars along the way. His negligence as it related to nursing homes is well known to all of us. President Trump pardoned Mr. Schwartz. I'm assuming he didn't consult you on that either. If we're going to talk about fraud, it's not the people just at the lower end of the economic scale. If we're going to pursue fraudsters, it's not just the people who might make simple, honest mistakes that could be corrected. It's the people at the top that help to perpetuate this fraud. And the administration's position seems to be that it's only the recipients and not the providers that can commit fraud. We are not defending fraud, we're not cheering for it, we're not excusing it. But there needs to be an even-handed approach, including not passing out pardons to people that might be supporters of the administration. So let me, on a nice note, thank your staff here in front of all for helping me out recently, or helping my constituents out, on an issue that related to daycare. Your staff came to the aid of a Head Start provider in my district and really helped out 100 families. The problem is that we don't want that to be something that can be completed by senior members of the Ways and Means Committee coupled with a group of administrators who know the problem and have come to the assistance of those who need it. But it shouldn't be that way. It needs to be more universal, and the cuts that are being proposed to these initiatives are not helpful to the American family. I look at these decisions, and if we're going to pursue fraud, Mr. Secretary, it has to be across the board. And we want an even-handed approach to these fraud investigations, including those whose schemes have cost the American taxpayers hundreds of millions of dollars. I yield back my time.
Mr. Smith.
Thank you, Mr. Chairman. Thank you, Secretary, for being here this morning and entertaining our questions. I represent one of the largest land area districts in the country, and most of my constituents live in rural and even remote areas. Agriculture is the engine of our economy in my district, and we're proud of our role in feeding not just America, but the world. Now, before I get to my questions, I would like to stress the importance of modern agriculture practices in producing a healthy, affordable, and sustainable food supply. The agriculture industry depends on our standards and regulations being science-driven and risk-based. I do want to say that threatening the availability of technologies could inadvertently lower yields and actually increase the price of food at a time when many Americans are already struggling to make ends meet. So I encourage you to continue to bring farmers and ranchers to the table as you consider matters relating to agriculture. Moving on, I do want to talk about rural health. You mentioned the Rural Health Transformation Program. I think that means a lot to so many of our constituents, our communities, our states. The RHT programs notice a funding opportunity recognize the important role of pharmacists in meeting rural communities' health needs. I believe that pharmacists are an underutilized part of our health system. Nearly 9 in 10 Americans live within 5 miles of a pharmacy, making pharmacists among the most accessible health professionals. Because of the broad accessibility, I think there is more we should do to empower pharmacists to help meet rural health needs. That's why I introduced a bill we call ECAPS that would improve access to care for seniors across America by providing Medicare coverage of pharmacist-administered tests and treatment for common illnesses like COVID, flu, and strep. By allowing pharmacists to test and treat seniors for common illnesses, we can make these services more accessible and reduce pressure on emergency departments. I do want to ask, what is your approach to improving access to healthcare services for Americans who live in rural and remote areas, and what can we do to ensure Americans in rural areas aren't left behind in our healthcare system?
I mean, last week I went to Arizona to announce an unprecedented $125 million investment in community health centers, which are serving 39 million Americans, mainly in rural areas around the country, to improve nutrition and also retention of their workforce, which is one of the reasons that so many of our rural health programs, so many parts of it are failing today. We've seen closures of 120 rural hospitals since 2010. It is a crisis when these hospitals close. It doesn't just deny access to health care. Those hospitals are economic drivers for their community. They're the highest paid jobs. They're oftentimes the biggest employer. For that reason, President Trump made the biggest investment in rural health care in American history, a $50 billion Rural Health Transformation Fund. Right now, Medicaid gives about 7% of its money to rural hospitals, and it's about $20 million a year. Well, we're increasing the flow of federal dollars to rural community health care, an extra $10 million a year. So that's a 50% rise over the next 5 years. And it's going to give those hospitals the ability to upgrade their infrastructure, to install telehealth, to move to AI, and to retain workers and do all the other things they need to achieve permanent stability.
I appreciate that. And just in closing, and I just want to note, moving to CMMI, Center for Innovation, I appreciate its intent. I do believe it lacks some transparency, and especially when CBO found CMMI's activities increased direct spending by $5.4 billion. So my time has expired, but I would encourage you to take a look at that so that we can make sure that innovation drives cost savings and better outcomes rather than just driving more spending and not positive results. Thank you.
CMMI has been disastrously mismanaged in the past. We are changing that. We're making it a center for innovation that Congress intended it to be.
Thank you.
Mr. Doggett.
Mr. Secretary, since waste, fraud, and abuse has been something of a watchword in this administration, I'm sure that you're familiar with the December 3rd Government Accountability Office response to a request by Chairman Smith, which reported significant agent and broker fraud with the Affordable Care Act, including brokers signing up people who didn't even know they were signed up. As you're aware, last May, under your authority, CMS fully reinstated all 850 brokers and agents who had been suspended back in 2024 because of suspected ACA fraud. Can you guarantee to our committee today that every one of those suspected brokers and agents was thoroughly investigated and found to be innocent of any fraud, any wrongdoing, or criminal activity?
I can tell you.
Can you, sir? Yes or no? You can't answer that. That is very troubling, I must say. 850 people accused of fraud, suddenly reinstated all at once. Do you know whether any of these suspected fraudsters who were reinstated so swiftly were subject to any additional oversight under your authority? Have there been guardrails that have been put in place to ensure those 850 agents don't continue to commit fraud?